Over the last week, we have averaged 239 deaths per day, an increase of nearly 48% over the prior week. Each death is tragic and even more heartbreaking when we know that the majority of these deaths could be prevented with a simple, safe, available vaccine.
With hospitalizations and deaths on the rise, the CDC director says the highly contagious Delta variant now accounts for 83% of new COVID cases. Have we entered a fourth wave in the pandemic? Welcome back to Morning Joe. It is Wednesday, July 21st. Joe has the morning off. Along with Willie and me, we still have the AP's Jonathan Lemire, and MSNBC contributor Mike Barnicle joins us as well. Let's begin right there with the dangerous Delta variant. As we said, now responsible for most new COVID infections. A full 7 months after the first highly effective vaccine became available in this country, hospitals are again inundated with a surge of very sick patients, and the number of cases is climbing across the country. And now more elected officials are working to get people vaccinated. Last hour, we mentioned Congressman Steve Scalise of Louisiana. At first in April and in May, when he was asked if he was getting the vaccine, he said soon. He finally got his first shot this past Sunday and publicized it, saying, quote, "When you talk to people who run hospitals in New Orleans or other states, 90% of people in the hospital with Delta variant have not been vaccinated." That's another signal the vaccine works. The House Minority Whip added that the vaccine is safe and effective. Willie.
Meanwhile, Senate Minority Leader Mitch McConnell again is encouraging Americans to get vaccinated as the United States sees that surge in COVID cases. McConnell has been one of the most outspoken members of his party, urging vaccination to stop the spread of COVID.
These shots need to get in everybody's arm as rapidly as possible, or we're going to be back in a situation in the fall that we don't yearn for, that we went through last year.
Meanwhile, more than 200 Missouri pastors are teaming up to promote vaccination. The Christian faith leaders will launch an advertising campaign and issue a plea for Missourians to get vaccinated, quote, as a way of following Jesus' command to love your neighbor as yourself. The idea was spearheaded by a Christian magazine in the state of Missouri. Let's bring in Director of the Center for Infectious Disease Research and Policy and a professor in the medical school at the University of Minnesota, Dr. Michael Osterholm. Dr. Osterholm, it's good to see you this morning. We'll get into the particulars of where we are in this country right now, but I'm curious what you think about the importance of these kind of what's being, trusted partners, as they're called, inside these communities, inside Christian communities. Someone as prominent as Mitch McConnell or Steve Scalise, who's been hedging about whether or not he thinks people should get vaccinated, not just getting vaccinated, but posting a photograph of himself getting vaccinated, perhaps a statement of how serious things are getting across the country.
Well, let me just put one number out to begin the discussion with, which I think should be our focus. 100 million. There are 100 million Americans right now who are not vaccinated or who have not had COVID yet and developed their own immunity. Some of these are obviously kids that can't be vaccinated yet, but it gives you an idea just how many people left for this virus to infect. So we need all the help we can get. Right now, we really have three different groups of people in this country with regard to vaccine. The vaccine affirmative, people like myself who couldn't wait to get the vaccine. Then we have the vaccine hesitant, people who really are thinking about it, they want to get it, but they still have concerns about its safety. And then there's the vaccine hostile. I'm not sure we're going to change that vaccine hostile, but I think there are a lot of vaccine hesitant people right now that we could move, and the leadership of the Republican Party, of certain kind of media venues that can help come forward, but can only do nothing but help us with that vaccine hesitant group.
Dr. Osterholm, you've always been incredibly straight and blunt with us over the last year and a half as we've walked through this pandemic together. So in your estimation, where are we right now?
Well, we surely are in an area of uncertainty, but I would like to, I think, add a context to a lot of the comments. People are worried about, we got to get vaccinated now for the fall. I don't know that the fall is going to be it. I think it could be right now. For the first time in the pandemic, we're seeing cases increase substantially in all 50 states. Surely less in the Midwest and the upper Northeast, but we're actually seeing right now 42 states that have had over 100% increase in cases in the last 2 weeks. This variant is a bad virus. It's 1,000 times more virus produced when someone who's infected. It clearly is much more infectious than the previous strains, and it's a virus that will find you if you're not vaccinated. Well, we have to tell people you can't, wait out the clock on this one. This is not one that, one day I can say, well, I avoided it. This virus will eventually find you. You have a choice. Either get vaccinated and be largely protected, or not get vaccinated and run the risk of being hospitalized in intensive care or even dying. And even last but not least, because we can't vaccinate our kids right now, you want to bubble those kids as much as you can. Don't bring the virus home and infect one of your kids. I actually know of personal experiences where adults have brought the viruses home, their kids have gotten infected, and they become seriously ill. You don't want that to happen. Get vaccinated.
Dr. Osterholm, Mike